Hello, my name is Natalie Blass, and I'm here with Lauren Moore to present the pros of substance use on mental health. Substance use and how does it affect mental health? Substance use is a consumption of drugs. It can lead to depression and other mental health issues. However, substance use can reduce anxiety and uplift moods. So today we will go over the positives of substance use on mental health. It's important to recognize the pros of substance use to reduce the stigma and to challenge your critical thinking skills by balancing your understanding to see both the negatives and positives of substance use. Acknowledging that substance use isn't always bad is part of keeping an open mind. Historically, substances have been used for medicinal, spiritual, and recreational reasons. Ancient cultures used plants like cannabis and ayahuasca for rituals and healing. Early Western medicine used opium for pain, and MDMA was used for therapy sessions. Each time, people recognized the benefits. Society panicked, laws were enacted, and research was stalled for decades. Recognizing the pros doesn't mean glamorizing substances. It means admitting the world is complicated and refusing to simplify substance use as bad. Open-minded conversations are the reason why science can grow. Let's go over alcohol versus marijuana. Drinking is normalized. It's something that someone can do all weekend, every weekend. However, alcohol is considered a substance. Alcohol is a drug. If drinking is so normalized, why not see the good in other drugs? So here's a list of some good substances. Fentanyl is used to relieve pain after surgery. Caffeine, very commonly used, is an energy stimulant. Marijuana is a psychoactive drug used medically, recreationally, and spiritually. So yes, drugs can have their side effects, but so does drinking, and people still do it. Substance use is normalized in society. The positive of drinking is that it's fun, but there are a whole lot of negatives, so why is drinking more normalized than a substance like cannabis when it has a longer list of positives?
Although marijuana is often stigmatized, it has several medical uses in therapy. It stimulates the patient's appetite and helps alleviate depression and anxiety. And it can also help alongside group therapy and psychotherapy for the added support. Marijuana is often commonly used to relieve chronic pain, in particular cancer patients. It helps relax the muscles, counteracts the appetite lost by harsh treatments like radiation by acting like an appetite stimulant and promotes relaxation. Marijuana can help patients feel more comfortable and maintain better quality of life throughout their treatments. In addition, this section shows the different dosage levels for people who consume marijuana. They use it in the traditional plant form as a blunt or a joint, and it explains the THC intake levels that are appropriate for beginners and what levels they should be avoided, and how they offer different needs to occasional and experienced users. Edibles are often preferred by people who want to avoid the process of rolling or smoking marijuana. They come in many forms, such as gummies, tablets, or even chips and cereals, which can be easily ingested. After 30 to 45 minutes, the effects begin, providing relief for patients who are dealing with mood disorders or severe pain. Many cancer patients, for example, choose edibles because of their pain makes handling and smoking cannabis very difficult. Older patients may also prefer edibles as the physical effort required for smoking can be too strenuous. Edibles are considered the healthier option than smoking because they do not harm your lungs or airways, though responsible use is essential. In this chart, I'm showing the recommended consumption levels for edibles compared to smoking the plant. Beginners should start at a lower dosage, while more experienced users can handle higher amounts. By taking an experience level dosage as a beginner can be very risky, and it is very important not to overdo. The next substance I will be talking about is MDMA. MDMA is something used in therapy alongside psychotherapy to help patients address deep-seated trauma. In these sessions, MDMA is administered in a controlled clinical or hospital setting, typically with 2 or more trained therapists present. The goal is to help the patient with PTSD, anxiety, depression, or eating disorder and or other trauma-related conditions by promoting an emotional openness and empathy. This practice often involves moderation and microdosing to ensure safety. These sessions are conducted in comfortable, safe environments where patients may lie down, relax, and even wear an eye mask while discussing their experiences. Each session usually lasts 6 to 8 hours with a total of 1 to 3 sessions spread over the 3 to 4 week period. Although MDMA is a psychotherapy is generally considered the treatment for a last resort treatment. It has shown the promise in keeping patients in the comfort and understanding of their trauma more efficiently. Ketamine, like many of the other treatments that I've been discussing today, can help with depression, anxiety, PTSD, mood disorders, and chronic pain. Over the past 30 years, ketamine has been used for medical practices for its versatility, including the treatment of narcolepsy. It aids psychological healing by blocking pain signals and reducing medical distress with short-term and minimal side effects. Study shows that nearly 80% of patients who experience lasting relief and may not require any further treatment. Typically, ketamine therapy involves 5 to 6 infusions over the course of 2 to 3 weeks. The use of psilocybin affects the brain serotonin system, engaging with the frontal cortex, influencing endorphins that contribute to the feelings of happiness. This altered experience shows a promise for people suffering suicidal ideation, depression, anxiety, or severe OCD, and substance use disorders, including excessive alcohol and tobacco use. Studies indicate that the patients who have used psilocybin experience improvements in their mood, reduced anxiety, and lower stress and depression levels. Like many substances, caffeine is best to be enjoyed in moderation, yet offers several benefits. For individuals with ADHD, caffeine can be a calming and focusing effect, which contrasts with with more stimulating impact it typically has on those without. When consumed responsibly, coffee can be a valuable part of our daily routine. For most adults, 3 to 4 cups per day is considered a healthy range. Studies suggest that a simple cup of coffee daily can improve focus and performance in daily tasks. Certain drugs can have positive effects on the brain when used carefully in controlled settings. Some, like cannabis or MDMA, can improve the mood and reduce anxiety and promote relaxation, while other opioids or cannabinoids can relieve pain. Stimulants like coffee can enhance focus and alertness in the short term memory, making tasks easier to manage. Medically studied substances like ketamine and psychedelics may promote narcolepsy, helping the brain reset, and support recovery from depression, PTSD, or emotional damage. Additionally, some drugs have shown to boost in creativity, learning, problem solving by altering the brain's process information. While these effects can be beneficial, they are highly dependent on dosage, context, and the individual's brain chemistry. And any misuse can lead to serious risks.
I mentioned earlier that substances can be used for spiritual purposes, and I want to talk about a couple of those substances. Ayahuasca is a drug derived from the Amazon, used in traditional shamanic practices. It's a process of the spirit detaching from the body and entering a spiritual world. It's used for healing and a spiritual journey. People that have taken ayahuasca claim that the effects are positive, life-altering changes, some of them being understanding the root of their trauma and letting go. Some may get out of a depressive episode for several months. It increases empathy, and it causes ego death. Ego death is when people look at themselves from a third-person point of view and reconsiders who they are. Physiologically, DMT, the main active ingredient in ayahuasca, activates the sigma-1 receptor, a protein that blocks the neurodegeneration and regulates the production of antioxidant compounds that help protect brain cells. This reduces inflammation and stops stress that leads to brain decline. The exposure to harmine, another active ingredient, makes cells generate the growth of new neural cells in the brain. In other words, the brain repairs itself. So ubulawu, also known as the dream root, is a traditional psychoactive medicine used by Bantu diviners for healing ceremonies. Ubulawu is used in a spiritual psychological process where healers connect the diviner trainee with their ancestral spirits. It helps the trainee regulate, understand, and completely change their psychological distress. They connect with the spirits through dreams, intuition, and awareness. In an ethnographic study, Jean Soybecki wanted to find how ubulawu changes consciousness and why it matters when it comes to healing. Soybecki's findings were that ubulawu increased dream vividness, connected people spiritually, which gave them a sense of purpose, and regulated people's emotions. Ultimately, Soybecki found that ubulawu functions as mental health intervention. When it comes to substance use, moderation is key. One of the ways moderation helps substance use stay positive is it supports mental health. A moderate amount of substance use can improve mood, reduce anxiety, and allow people to heal. Acting as a form of therapy, substance use can help people process emotions instead of ignoring them. It helps people heal and move on, overall reducing anxiety and negative thoughts. It also supports the nervous system. Moderation can lower fear responses and help people recover from trauma. It allows people to process their emotions, thoughts, and memories without feeling panic or anxiety. It promotes sleep. People report having deeper and better sleep while using substances. Better sleep equals a happier mood. It also prevents addiction. And I know that it's crazy to talk about addiction prevention on a presentation about the pros of substance use on mental health. However, moderation allows substances to be utensils for healing and not become tools to avoid life.